Guys, the other day I received a very interesting question. Dr. Mario, does osteomyelitis have stages? Does orthopedic infection have stages? So I thought, yes. And I'll explain. My name is Mário Soares. I'm an orthopedist with a professional focus, passionate about talking about and treating orthopedic infections. Let's talk in terms of stages, from the least serious to the most serious. Infection is always something serious, but there can be something worse, right? And then it's always related to time, right? That's the key to answering this question. When I have an infection that has just happened, for example, the person has had an operation, and then a week later there's pain, it's inflamed, it's red. Pain, it's inflamed, it's red, secretions are coming out. It's very acute, it's very, fresh there, let's say. What's the goal here? To correct the infection as quickly as possible. Now, the damage caused to the tissues is practically none. As time goes by, the body reacts to that infection. And then what happens, which is the most serious, right? Where does this path go? You destroy the tissues involved. So osteomyelitis, let's put it this way. In very simple terms, what is osteomyelitis? The bacterium has entered the bone and caused the bone to die. So, Mario, is the bone dead? Yes, there's a piece of something dead inside me? Yes, that's right. Can it stay there? No. So, there's a difference between a little dead piece and a dead piece. So that's bad for you. If you have a little piece, we go there, we take it out, we don't have to do much. Now, if I have a piece of dead bone, I have to take that whole piece out, I have to rebuild it. And how do you change from a small piece to a piece? Time. Has it taken too long to act? You lose. You have an infected prosthesis. What will happen to the infected prosthesis over time? It will come loose from the bone. Okay, so it's a characteristic, it comes loose from the bone. Okay, it's detached from the bone. What's the problem? It starts to move around inside the bone. As well as causing you pain, it starts to wear down the bone through movement. So remember, there are prostheses, right? Let's say a hip prosthesis, more or less, is this big. The whole thing is moving and it's wearing down. If I take too long to act, I'll lose a segment of bone where the prosthesis is. Knee prosthesis, same thing. A plate, a rod, ditto. So the idea here is not to waste time, because over time, the body starts to react to the infection, the inflammation related to it. Another thing, right? So, for example, due to infection, what is pseudoarthrosis? The person has a fracture, they've had an operation, and it hasn't consolidated, so that bone that was supposed to stick didn't stick. That's pseudoarthrosis. When it's related to infection, it is, in other words, why didn't it stick? Because it's infected, it's become an unfavorable environment for the bone to consolidate. What happens, Mario, if this happens? Well, first of all, we use some metal to hold the fracture together. If the bone doesn't stick, that metal starts to fatigue. Then it ends up breaking. Those patients who have a broken plate, a broken rod inside them, why is that? Because it took time to fix it. It starts to create increasingly destructive changes at the site. So, to treat that pseudoarthrosis, I'm going to have to resect the bone. It's going to be complicated to remove that metal that's been broken, isn't it? Other changes in the muscles, the way they work, the leg shortens, right? Or it usually happens in the lower limbs, they end up shortening, the muscle shortens. So getting it to length afterwards is more complicated. The sooner you treat it, the better. Less damage happens, right? So this evolution we're talking about, right? How do you make something less serious? It's always serious, but less serious to much more serious is related to time. So that's one of the reasons why you shouldn't waste any time and should seek treatment as soon as possible. Is there anything else? Let it roll. What's up, guys? So let's think about it this way. Well, we've talked about the simplest, haven't we? Let's get to the most serious. Are there some things that are more serious than the most serious? Yes. If you're compromised, right, well, it's been a long time. If it's so badly compromised that it's impossible to dry it out, right, to get it out and have options for reconstruction. The only option is amputation, for example. So it often ends up that amputation has reached this level because there was nothing else to do. But why was there nothing else to be done? Because sometimes it took too long. And then it got so bad that for lack of an option, it's better to amputate. So remember that. We've talked about amputation here in other videos, but one of the causes of amputation, one of the indications for amputation is simply not having anything to do. So I need to treat the disease, but I don't have any reconstruction options. So it ends in amputation, sometimes a disarticulation near the groin. So these are unpleasant situations, but they're often related to time. And taking advantage of the amputation issue, we have a series of videos here on the channel that talk about behavioral orthopedics, which is nothing more than what are all the other aspects, minus the technical aspect of the whole thing that influence the result, and especially in amputation. So that's one I've talked about here. Time. It took a long time to get treatment, but why did it take time? So all this is part of behavioral orthopedics. Why did it take time? Well, I don't know, lack of money, lack of access, lack of information. All of this is behavioral orthopedics. Don't forget to watch these other videos here, which are very important for clarifying your case. What's my message here? Don't waste any time. As soon as there is a suspicion, or as soon as there is a diagnosis of an infection, go after it so that you can solve it. And one of the solutions, let's put it this way, something that will support you in your quest is the information here on the channel. So check out all our videos here. Most of my patients marathon the videos. They know a lot, practically everything. They arrive at the consultation and they really speak the way I do. And it makes it much easier for the outcome later on when we operate, do a procedure, or even talk to them. They already know. So marathon sessions are part of the treatment, okay? So the channel itself is already a kind of treatment. So don't stop subscribing, share it with others, and if that's the case for you, send us a message on WhatsApp, okay? So you can try to make your teleconsultation or your face-to-face consultation. But what is the message of today's video? Don't waste time. Time is important when it comes to orthopedic infection, okay? Cheers and see you in the next video.